Hello, everybody. I am staring at myself right now. How's everybody doing? Let's see. We have. Why do we only have me? Oh, I'm learning the Zoom as I go along. There we go. Now I see everybody. But I'm going to keep admitting people in. This is going to fill up wicked fast because I only have 100 people. And I apologize. We're new to all this Zoom stuff at my firm, so we're kind of figuring this out as we go along. So let's see. I'm going to keep kind of bumping people in here as we go, and then I'll explain how this is going to work for the hour that we are in with everybody. All right. I should not have require me to admit people, because now, like I said, I'm kind of learning as I go. So, and hopefully, oh, looks like somebody, oh, hi, Eric. Looks like I can be heard, which is good. All right. So, a couple of things before we start. Everybody should be set on mute. I'd like to keep it that way. If you have questions for me, please just type them in the chat box. I'll do my best to get to everybody's question kind of as we go through the next hour or so. And then this should, if I set this up right, it should also then do two things. It's going to save the video, so I will be able to push this out for everybody who has not been able to get into the room to watch at a later date. And then it should also save the chat log, so that if there are questions that I haven't been able to get to, I will be able to go back and answer those questions. As I after the fact, I'll either put out a blog post or do something. Okay. Secondly, everyone's on mute. Please keep it that way. That way we're not going to have 100 people talking over each other. And then please, 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 please don't share your screen. I don't want to know what's on your desktop, and I don't think you want everyone else to know what's on your desktop either. Those are kind of the rules of the road. I thought I'd start out with something light, and then we move into kind of the meat of what's been going on in the coronavirus world. My quarantine haiku is trending on Twitter right now. So about half an hour ago, I drafted up my own. I thought I'd share. And then we kind of get into where we kind of are in the state of the coronavirus world. So my quarantine haiku, rather, daytime pajamas. I don't have hair to pull out. Nighttime pajamas. 575, thank you very much. That's where we are in the world right now. My quarantine haiku. Okay. Thank you, Dawn. Bravo. Haha, very funny. Okay. Look, we got to do something to keep ourselves from like going crazy at this point, right? So where are we in the state of the coronavirus world right now? The Department of Labor yesterday put out a Q&A about the Families First Coronavirus Response Act, giving everybody some information about how this law is going to be implemented. The biggest surprise in the Q&A that the DOL put out is that the DOL announced an effective date of the Families First Coronavirus Response Act of April 1st. The law said it had to be enacted, or it had to go into effect no later than 15 days after it was signed. It was signed on the 18th. We all, employment lawyers, HR folks, whomever, did the math, and we all calculated We all calculated 15 days to be April 2nd. And then, surprise, we got the DOL's Q&A yesterday, which said that it had an effective date of April 1st. So, yeah, the statute said no later than 15 days. We figured employers would have the full benefit of those 15 days in order to get their paid leave houses in order. For a lot of companies, this paid leave is going to be new to administer and to manage and to roll out. Companies need policies. Someone is asking in the chat if I know the status of the DOL compliant employee notice, the act, unless the DOL published it in the last 5 minutes. The answer to that question is no, I do not know the status of the DOL compliant notice. The act itself says that notice must be, DOL would put it out or must put it out within 7 days of the act being enacted. The act was enacted on, just a reminder for everyone to please mute your audio. This is, we're going to keep everyone muted. If you have questions, please put it in the chat box and I'll get to everybody's questions. DOL said they're going to put the notice out within 7 days of the act being enacted. It was enacted last Wednesday, which means that if the DOL is following the statute, that notice should come out today. But currently, unless it was published in the last 5 minutes or so, that notice has not come out. Okay, so an effective date of April 1st, to everybody who has under 500 employees, has until a week from today to comply. Some other things of note in that DOL notice: what does less than 500 employees mean? The DOL says you're to count all employees, full-time and part-time, in that head count. You're only counting U.S. employees only. So if employees work for either expats or employees that work for overseas operations are not counted for purposes of that 500 employee threshold. We're counting employees, even employees that are on a leave, whether it's one of these coronavirus leaves or another leave of absence. Those employees are counted. You're counting temporary employees, whether they're employees that are provided by employees provided through like a staffing agency that's a joint employer, or day laborers provided by an agency. They're all counted for purposes of this 500 employee threshold. Most importantly, and what's going to cause employees that are right, or employers that are right on the cusp of this 500 number, is that employers are to make this count every time an employee makes a request for leave. So every time an employee makes one of these coronavirus related requests for leave, an employer is supposed to count whether or not we are or are not at this 500 employee threshold, which means that for some employers, you're going to have employees that qualify and employees that don't qualify for this paid family leave and paid sick leave, which is going to be an administrative nightmare for a lot of employees that are right on, or employers rather, that are right on the cusp of this, paid, of qualifying for this paid leave. What else was in this Q&A that the DOL put out yesterday? The DOL gave some preliminary guidance on how we're supposed to be counting an employee's regular rate of pay. Essentially, you're kind of throwing everything that an employee makes and dividing it by the number of hours that an employee works. It's supposed to have a 6-month look back and an average over the last 6 months to figure out what that regular rate is, and it's going to include, when you're paying it out, it's going to include overtime that the employee would have worked in the week if it's a non-exempt employee. But again, remember that there are caps on how much an employer is required to pay out in this paid leave. For the paid family leave, it's $200 per day or $10,000 in the aggregate. for paid sick leave for an employee's own illness or quarantine or at home because of symptoms or diagnoses or treatment, it's $511 per day or $51.10 in the aggregate. And for any other reason, it's $200 a day and $2,000 in the aggregate. Clock restarts on 4/1. So if you're one of the employers that has been nicely providing leave for your employees now, that's wonderful. I've been encouraging as many clients as I can to do what they can for their employees as their financial ability allows them to do it. If you've been providing leave for your employees now, that clock is going to restart or reset on 4/1, such that you're going to have to re-provide leave for employees or provide this paid leave for employees per the statutory requirements come April 1. And then the question I've been getting a lot from my clients, I'm at a smaller law firm. A lot of my clients are small to mid-sized businesses, and a lot of my clients have been asking how the small employer exemption works. Company of 5 employees, 10 employees, doesn't have, or where providing this might provide a hardship. It is the language that the DOL has put out is if compliance would jeopardize the viability of the business. That's all we know so far. The DOL has said a couple of other things, and this will be flushed out in the regulations that we'll hopefully see before April 1st. Number one, this is self-actualizing in that an employer, the DOL does not want and is not requiring and will not grant these exemptions to employers. You don't submit an application to the DOL for the DOL to say, yes, you are, this would jeopardize your viability. You are therefore exempt, don't have to provide this paid leave. Employers are making this decision on their own as to whether or not they are qualifying for this exemption. And then from a best practices standpoint, I mean, you want to be able to establish or prove that you are, if challenged, either by the DOL in an audit or by an employee that says, why aren't you providing this paid leave? You're going to want to be able to establish that you actually meet the standards. So you're going to have some financial records or something that's going to back up how you are, why you believe that providing 80 hours of paid sick leave to your employees and 10 weeks of paid family leave would legitimately jeopardize the viability of your business. That's the Q&A that the DOL put out yesterday. In terms of where we are from questions that people are putting out, I see a lot of questions have come in. We'll make this as interactive as we can. I'm happy to sit and talk coronavirus with you all day, but I know everybody's here and I would like to be able to answer questions that people have. And so please keep typing them into the chat box and I will get to them all over the course of the next 45 minutes or so that we're with you. I'm just going to start reading them off from top to bottom and we'll go from there. How should we handle people who we sent home to self-quarantine if they said they were exposed last week and this week before the 4/1 effective date of the paid leave? I see we should not require people to use their PTO. So if you have people that are out now because of either they've been exposed, they're sick, they've been exposed, they're self-quarantining, what do? They certainly can tap into their PTO now. You can send them home with pay and not run down their bank of PTO. You can do whatever you want for these folks between now and March 31st. Do the math in my head. Just remember if March had 30 or 31 days. March 31st. Come April 1st, this paid leave is going to kick in, which means that if you have an employee that is off of work now because of any reason that qualifies under for a paid leave under the FFCRA, come April 1, they're going to get a fresh bank of 80 hours of paid sick leave and then 12 weeks of family leave, the last 10 of which are paid. And at that point, you cannot, per the statute, require them to use their available paid time, whatever available paid time off they have in the bank. Per your policies, you cannot, as of April 1, require them to use that leave for a reason that qualifies for paid leave under the Act. You can, up until April 1st, require them to tap into their PTO, take their sick time, whatever paid leave you have available. You can absolutely require them to use that now. But once April 1st hits, you are statutorily prohibited from requiring employees to run down their paid leave before they can tap into these federally available paid leave benefits. And quite frankly, from a practical standpoint, you don't want them to anyway, because remember that this paid leave that's available under the statute gives employers a dollar for dollar tax credit against payroll taxes. You can't claim that credit if your employees are taking your own employer provided PTO or sick time or other things. That's just what you're providing to your employees, and they take it, and that's money that's coming out of your your account to fund your employees' leave, period. The paid sick leave and paid family leave, you get a tax credit for. And so really it's to your financial benefit to have your employees use that leave when it's available to them, because you can then claim the tax credit and get that money back that you're paying out to these employees for this paid leave. Okay, next question. Staff currently not working, on layoff, will those inactive be eligible for the new sick leave and family medical leave plus the extended or enhanced family medical leave? Likely the answer to that question is no. If people are not working, whether they're on layoff or on furlough, in all likelihood, as myself and just about everyone else I've talked to on this issue are interpreting the statute, those individuals will not be available for sick leave and this enhanced family medical leave. As the statute's written, those that are on furlough might qualify, as you're counting these 500 employees, because they're still on payroll, they're just not working. But in terms of whether or not they're actually eligible to tap into this paid leave and take the paid leave while they're on layoff status or furlough status, the answer to that question is, as I interpret the statute, is no. Hopefully, when the DOL comes out with their regulations, this is a question that keeps coming up over and over and over again. Hopefully, when the DOL comes out with their regs, again, hopefully before April 1st, so we get some more concrete guidance on exactly how this is all going to work. Hopefully that's a question that the Department of Labor will be answering more with some more clarity. Okay, next question. My team is trying to understand how to interpret the eligibility requirements under the FFCRA as it relates to FMLA. Are employees eligible for 12 weeks regardless of whether or not they can still work or telework? What level of care to an employee's child is necessary to prevent them from being able to work from home? Can this be taken intermittently? Example, an employee is able to negotiate with spouse days on and off working / providing care to children. That's a series of great questions that, again, we don't have a tremendous amount of clarity to. We're hoping the regulations gives us the clarity, but here's kind of my best thinking on those questions currently. Are employees eligible for 12 weeks regardless of whether or not they can still work or telework? The answer to that question is, employees are eligible for the 12 weeks. As long as you've worked for 30 days for the company, you are eligible for 12 weeks of this extended or expanded FMLA related to coronavirus, childcare related absences. However, the leave is only available to take if you are unable to work or telework. So if you are able to work from home while your children are home from school, or your children can't go to their childcare or daycare provider, then you cannot take um, paid family leave or tap into your 80 hours of paid sick leave, for that matter, for childcare related purposes. I think it's an open question as to what level of care is necessary to prevent someone from being able to work from home. My kids are, I'm obviously working from home, but if I was unable to work, I mean, my kids are 11 and 13. They're fairly self-sufficient at this point. So it's going to be hard for me to claim that I can't work from home because I need to take care of my kids. It's going to really vary on a case-by-case basis. I would, again, encourage employers, where possible, to interpret this liberally, be flexible, and act with some level of compassion towards your employees. This is difficult for everybody, companies and employees together. And so I think a lot of this is going to have to be taken on faith between the company and the employee, between, what is quote unquote, got to get the air quotes in the camera, quote unquote care for a child. And it's going to vary on an employee by employee basis. And to dovetail into the last part of that question in terms of whether this can be taken intermittently, again, not clear in the statute, but I would say, to the extent this is an amendment of the FMLA and the FMLA allows for intermittent leave, I would say it probably can be. And so I think one's ability or inability to telework might change hour to hour, day to day, based on what's going on with one's children, and arrangements that one might have with one spouse, in terms of what days people are going to be on or off to care for children. I'll take care of them in the morning, you take care of them in the afternoon. I'll take care of them Monday, Wednesday, you take care of Tuesday and Thursday, and then we'll split Friday up, whatever. I think the definition of unavailability to telework or to work remotely very well might change for an employee as the day goes on. The regulations might say differently when they come out, but right now my interpretation is this intermittent type of leave for childcare purposes. And I would add, I think the sick leave, to the extent you're taking sick leave, for example, to care for a family member, there's no rule that says those 80 hours must be taken in one 80-hour block, and there's no reason to say that an employee couldn't take 8 hours of paid sick leave today because they need to go take care of their mom who has coronavirus symptoms, but they're going to work tomorrow because their sibling is going to be on that care schedule. And so working out schedules around this paid sick leave to care for family members as well, I think, is something that employers are going to have to deal with as we work through these issues once the statute becomes live on April 1st. Eric Myers, good to see you in the chat. Thank you very much. He says, per the US DOL's press release, a workplace poster required for most employers will be published later this week, along with additional fact sheets and more Q&As. That is tremendously helpful. And so while we couldn't count on the DOL to count to 15, I guess we couldn't count on them to get the effective date right. I guess we couldn't count on them to get the date for the poster right either, which should have been today. But the fact that they're promising it'll be out later this week is extraordinarily helpful, along with additional fact sheets and Q&A that are hopefully going to help flesh this out more for companies as we try to work through a lot of ambiguities in the statute. And look, I mean, this is, I said this on my blog, I think earlier this week, 5 days was a tremendously short amount of time for a piece of legislation this monumental to get passed. There are clearly loopholes in it that need to be closed through guidance or other regulations. But the fact that Congress, both parties in Congress and the president could all get on the same page and pass this legislation, and then the stimulus bill that was ultimately, I think, finalized and is going to be passed later today. I think it's kudos to everyone in DC for realizing that something needs to be done for folks now. And so part of what we're dealing with is because this legislation was so monumental and had to get passed so quickly. Yeah, we're dealing with loopholes that people got to figure out, but we're gonna work through them as best we can, and hopefully the DOL is keeping track of what these loopholes are as you're hearing from people, so they can hopefully tighten them up and or close them through Q&As, fact sheets, and the regulations when they ultimately come out. Can we force our employees who are not sick and ready and able to work to use PTO if we are still open but not enough work for full time? The answer to that question is yes. The PTO rules have not gone out the window. I would say check your policy first. Number one, to make sure that your policy doesn't limit your ability to require employees to use PTO. But as long as the employee is not asking for time off or taking time off for a reason covered by the statute, either for the expanded family medical leave or for the paid sick leave, as long as the employee is not taking time for a reason protected by the act, you can require employees to use your PTO or other, sick time or other available paid time for whatever reasons you want. So if you don't have work for them, or you're only working them X number of hours a week, and you're working them 3 days a week, they're off 2 because that's all that's available, you can force them to use those 2 hours of, PTO to fill in that, backstop those 2 days so they still get paid while you run down that bank of PTO. I would also say, however, that we're gonna, and I took a quick look this morning at the stimulus bill that will hopefully be signed later today, which I've, at least the unemployment provisions of it, I've heard described as unemployment on steroids. Unemployment is going to get kicked wide open for all states. We've had it here in Ohio, where employees that are on reduced schedules or on furloughs are available to apply for unemployment and collect unemployment to backfill wages that they're otherwise not earning because of reduced schedules. We're going to see that if what's actually in the bill matches because the bill hasn't been, I haven't seen the full text of the bill yet, but if the bill matches what's in the summaries I've seen, we're going to see that nationwide. And so if you have employees that are working on reduced schedules, you should be encouraging them to apply for unemployment, either in addition to or in lieu of running down their PTO. If they're collecting PTO or other paid time off while they're not working, that's going to limit their ability to collect unemployment. We have part of what's in this bill. I think there's going to be a $600 add-on to what employees can collect for unemployment for the foreseeable future. So the amount of what employees can collect from unemployment is going to go from like this amount to this amount. So there's going to be a lot more money available for them from state unemployment systems. So we should be encouraging employees, if we don't have the work available for them, to keep them busy on a full-time basis, to be applying for unemployment so they can tap into these funds that the feds are going to quickly be making available. Does it matter if staff are on layoff or furlough on April 1? 80% of our staff are on unemployment now as a result of COVID-19. That's incredibly sad, and I'm sorry for your business and your employees. From an eligibility standpoint, in terms of whether or not you as an employer qualify for the paid leave, counting whether you hit that 500 employee threshold, it may not matter. But from whether the employees can tap into or take this paid leave, if they're on layoff or furlough, my read of the statute is that they will not qualify for either this expanded family medical leave or the paid sick leave on 4/1 if they are currently on 4/1 if they're currently on a layoff or on a furlough status. Next question. Does a shelter-in-place order, I just looked up, my head is huge on this screen. Geez, I'm going to back up a little bit. Okay. Does a shelter-in-place order from a municipal, state, or federal government meet the criteria of quarantine or isolation order for paid sick leave? That's a great question. It's one I've also gotten a lot since Ohio's our governor, Mike DeWine, who's probably not watching, but he's done such a fabulous job managing this for my state, being extraordinarily proactive in trying to keep us Ohioans as safe as possible. So kudos to Governor DeWine for the job he's done for my state. Since our shelter in place or stay at home order was announced on Sunday and took effect at 11:59 on Monday night, it's something I've thought about a lot. It's a question I've seen a lot and been asked a lot. And I kind of went back and forth in my thinking on it, and where I ultimately settled and where I think is, and as I'm reading all of these state shelter in place orders, and I don't think there's a state, I think there's 15 states right now. And I don't think there's one that I would say I'm interpreting differently. The answer is no. I don't think a shelter in place order meets the criteria of a quarantine or isolation order for paid sick leave. And here's why. The stay at home or shelter in place orders, while they are requiring people to stay at home, it is not requiring that people be quarantined or isolated. People can, if they work for an essential business, can go to work. People can go to the grocery store, they can go to the pharmacy, they can go out and walk, take walks, around their neighborhood or in the park. They can walk their animals. It is open enough such that people, while they are stay at home or shelter in place, it is not a mandate that people be isolated or quarantined. People can leave their homes for any number of reasons. So, and at least in Ohio, even non-essential businesses can maintain some employees to keep the business going as operating as a going concern. You can have IT support come into the building so your employees can telework. You can have employees come in to maintain inventory. You can have security come into the facility to keep the facility safe. So even for a non-essential business, folks can be working. So my interpretation, because employees still have mobility, we're not ordered to actually physically quarantine or stay isolated and in place 100% of the time. My interpretation is that these state shelter in place or stay at home orders do not qualify for this for paid sick leave under the FFCRA. Next question. I should have kept a cup of water by me. We have folks on unemployment working 1 day a week if available. If they are sick the 1 day, does the new paid sick leave apply? The answer is yes. What might be impacted is the amount of paid sick leave they have available to them to take. They would be a part-time employee at the moment. The paid sick leave is done on the amount that employees have is done on a pro rata basis. So for an employee only working 20% of the time, they may only have 20 hours of paid sick leave available to them to tap into. But they're going to have some amount of paid sick leave available to them, even if they are collecting unemployment and on a furlough such that they're only working 1 day a week. Next question. Thank you all for the questions coming in. It's so much better answering questions than me just rambling on for an hour talking to you guys. And I'm happy to, really happy to provide this for everybody as a service. I feel like, if I can just step back for a second before I get to the next question, it's been incredibly therapeutic for me to have been pushing information out as quickly as I can to folks on my blog, on LinkedIn, on Twitter, on the Facebook page. And it's been incredibly therapeutic to know I've gotten a lot of like, thank you for what you're doing, and we really appreciate the information. And it's been very therapeutic for me to know that I'm contributing something to the public good as we're trying to move through this crisis together. So it's really my pleasure to do this for y'all, to get everybody information that we know is vital to help manage what is by far the biggest crisis that we're probably all going to deal with in our lifetimes. Okay, off my soapbox. It is my understanding that if you, quote, lay off anyone, that is ending employment, and you must pay out all final wages and vacation, insurance ends, etc. If this is true, then you should furlough your employees if your intention is to bring them all back in a month or two. Otherwise, for the layoff, you have to rehire them all. Is that correct? Yeah, that's correct. Layoffs are typically deemed to be a permanent separation of employment if you lay someone off as opposed to a furlough. I encourage you to check your state law, but typically, yes, you have to pay out final wages. You have to, you're going to have due to them all accrued and unused vacation time and other paid time off is going to be due to them, etc. A furlough is a temporary layoff. And on a layoff situation, it's also going to trigger COBRA as well. It's going to terminate benefits. In a furlough, however, it is a temporary layoff. It implies a recall when the furlough ends. You don't have to rehire the person. They're still on your payroll as an employee. They're just not getting paid. At least in my state, Ohio, the Ohio Department of Insurance, and I would encourage everyone to check with your own states as to what they're doing, put out guidance earlier this week saying that for employees on furlough, employees whose hours drop below 30 in a week, that is not considered a triggering event for COBRA coverage. It does not require employers to end health insurance coverage. We know that 30-hour threshold is critical under the Affordable Care Act, and it does not require employees to terminate coverage such that employers can maintain employees who are furloughed working no hours a week, 0 hours or 29 hours a week on furlough. You can maintain that health insurance without kicking employees into COBRA. Which is a massive benefit for employees because we know how expensive COBRA is for employees. Okay, next question. We are a nonprofit with employees. Looks like we may be exempt from reinstating jobs after leave. Are we also exempt from other elements of this law? If we voluntarily participate despite hardship, can we still apply for government to recoup dollars? How are businesses recouping these expenses? Is there a timeline for that? Do we need to document this out? There's a lot in that question. Do we need to document this separately from other time off? Can we be consecutive or ad hoc? Do we pay directly to employees, et cetera, et cetera, et cetera? Okay, well, there's a lot to unpack in that question. My understanding is the law applies to nonprofits just as it does to for-profit corporations. Number one, yes, there are specific provisions for nonprofits and small employers. You're going to recoup this via the payroll tax. The payroll tax credit. And I think the reason why it was tied to payroll taxes and not taxes in general is because I'm going to say I'm not a tax attorney. I don't want to be a tax attorney. I've learned more about payroll taxes in the last week than I've ever wanted to in my career. But my understanding is why this was tied to payroll taxes and not to taxes paid on wages is because nonprofits pay the former and not the latter. And so it gives nonprofits the benefit of this payroll tax credit. In terms of the mechanics of how this is going to work, we got some guidance from the IRS in a quick fact sheet they put out last Friday. And we're going to get more guidance from hopefully when the regulations come out. But my understanding at least is that this is going to be an automatic kind of self-effectuating credit that when payroll taxes are paid on a quarterly basis, you're just going to roll right off the top of those payroll taxes, whatever amounts qualify for the credit that you paid out to employees, that you paid out for this employees for paid leave. Do I know why medical professionals were exempted? I don't, but my guess as to why medical professionals were exempted was a policy decision that we need medical professionals to keep working. And I understand the next part of the question is they're also getting sick and or sent home from hospitals. Why did Congress decide not to give them these benefits when they can't go to work? I agree with you 100%. Maybe that was something that wasn't considered. I think the gut reaction was we want to exempt medical professionals because we need the medical professionals to keep working, to keep the medical system, the hospital system flowing so that we have people to take care of patients. But I also understand that these people are on the front lines. They're getting exposed on a daily basis and getting sick. And so why did Congress not decide not to give them these benefits and they can't go to work? I don't know. If there's medical professionals, employers of medical professionals on the call, again, this law is a floor and not a ceiling. And I would encourage you, if you have people that are on the front lines treating patients that have coronavirus and getting sick, I would encourage you to, if you can, do what you can for these folks if they can't work, even though this law doesn't require that you provide the paid sick leave to them. Employees on FMLA due to a medical procedure, they are in unpaid status currently. If they are not back by April 1, can they use the 80 hours? Well, they'll become eligible for it once they return from their FMLA. If they're not working currently, if they're on a leave, I don't believe they're going to be eligible for the paid sick leave. But again, that sick leave, it's not going to apply to their current unpaid FMLA for a non-coronavirus related absence. So they had a surgery 2 months ago, then all hell breaks loose with this coronavirus. They're out of work on this approved FMLA when this coronavirus hits the US, and now everybody's being impacted. Their absence isn't coronavirus related. Their absence is related to their prior approved FMLA. When they come back to work, they will then become eligible for the paid sick leave. And if they have childcare issues or other issues related, or their own coronavirus related illness or family members, they will then qualify for that 80 hours of paid sick leave upon their return to work. If an employee needs to take leave, Bryce, I wish there was a way that this would trigger to say, I'm a Myers-Roman client, put my question up to the top of the queue. So I'm sorry it's taking me this long to get to you, but here we are. Bryce, if an employee needs to take leave due to caring for a child, what's the relationship between the 10-week paid FMLA and paid sick leave act? How should these situations be handled? They work together in that the employee would be entitled to, but not required to, take their 80 hours of paid sick leave during the initial 2 weeks of unpaid, the initial 2-week period of unpaid FMLA. So the first 2 weeks is unpaid. They have 80 hours of paid sick leave available. They are entitled but not required to substitute or run concurrently that 80 hours of paid leave during that initial 2 weeks of unpaid FMLA. And then the FMLA then continues thereafter for the remaining 10 weeks. You can't require them to do that, however. It's the employee's option what to do. And if they'd rather take those 2 weeks unpaid or take other paid time off or whatever they want to do during that 2 weeks of unpaid FMLA, and then take and save their 80 hours of paid sick leave to use down the road in case they get sick or a family member gets sick or whatever, that's their option. And you cannot force any order of leaves under this act. Between staffing agencies and their client companies where they place staff, who has to pay for a temporary employee's leave under the FFCRA? I would assume it would be the same as any other relationship, in that typically it's the staffing company that pays, and then it's the employer where the employee is staffed gets invoiced for those wages. And I assume it wouldn't be any differently here. Although I would also imagine this is a situation that is not contemplated whatsoever in any contract between a staffing agency and an outside company. And so my gut reaction says the staffing agency pays the wages as they do in most cases, and the company gets invoiced. But I would encourage, if you're a staffing agency, to open up a dialogue with your clients as to how this is going to work. And if you're a company using temps, to again open up a dialogue with those temp agencies or staffing companies to figure out how this is going to work moving forward, so that everybody has an understanding. And maybe that requires contracts to be amended to specifically cover this situation, because God knows we lawyers need more work now to handle. But it is what it is. And if those contracts need to be amended to make clear how this relationship is going to work going forward, that's likely what might have to do. Does the FFCRA run concurrently with classic FMLA or no? Run concurrent with state leave laws? This is an amendment to the Family Medical Leave Act. It adds a new category of FMLA, and I haven't seen anything to suggest that this gives employees an additional 12 weeks of FMLA in addition to the 12 weeks they already have. So I think everybody's understanding, and if somebody's understanding is differently, let me know. But my understanding is that because this acts as an amendment to the FMLA, that it's going to just add another category of FMLA available to employees. And so if an employee already has used up 6 weeks of FMLA and they only have 6 weeks left, they may only have 6 weeks of this expanded FMLA available to tap into for these childcare related purposes. And which would be paid, however, because the back 10 is paid FMLA. The first 2 are unpaid. And so if an employee's used up their first 2, the last 10 are going to be paid and what have you. But my understanding is we're not creating a new entitlement of FMLA in addition to that, which is already available. What's the difference between a furlough and a layoff? A layoff is a permanent, they're both tied to economic situations. We can't afford to keep you employed anymore. A layoff is a permanent separation. It is, we are ending your employment for business or economic reasons. A furlough is a temporary, short-term, either reduction in hours, or a reduction in hours all the way down to 0, which would be a temporary layoff. The key difference being that in a layoff, the individual, the employee, is removed from your payroll. They're not an employee. They're not an employee anymore. In a furlough, they're an employee, just an employee with reduced or no working hours during the week. If an employee is on EFMLA, coronavirus FMLA, since insurance cost is covered, do employers not take out any cost share for insurance premiums? For paid leave, the rules are going to work the same essentially. To the extent that employees have premiums they have to pay, that can get deducted. To the extent that those premiums are otherwise covered, then they don't get deducted. You're not going to take deductions for things you don't need to take deductions for employees if they're otherwise going to get, if they're otherwise allotted, if they're otherwise covered or paid for. But to the extent they're not, then yeah, you would make the same deductions. With the 2/3 rate under the paid leave, how do we handle exempt staff? Is this an allowable deduction for salary folks? Example, we are an essential business, outside salesperson helping in a store, but he needs to be home to take care of a baby half of a day and work in the store the other half. I assume we cannot pay him half the day at the 2/3 rate, correct? There is actually an exemption in the Fair Labor Standards Act regulations to make deductions from exempt employees' pay for intermittent, for FMLA or intermittent FMLA. So to the extent you have exempt folks that are tapping into this EFMLA, you can make deductions from their salary to, and pay them the 2/3 for the hours they're taking the FMLA and pay them their full salary for the hours they're actually working. That's actually an allowed deduction under the Family Medical Leave Act. I see I still have 21 messages to get to and 11 minutes left in the chat, which is awesome. And I'm so glad that everybody's participating, and thank you all so much for your questions and everything else. Some of these have already been asked and answered, so I'm gonna skip. Are temps, not part-time employees, eligible for the 80 hours of sick leave? That's a great question that I'm actually at the top of my head. That's a question I'm going to have to, I don't want to give wrong information. If someone knows the answer off the top of their head, I think that the temp is an employee of the temp agency. I think the temp agency would potentially be liable for the 80 hours of paid sick leave there. And then again, it'd be an issue of invoicing between the temp agency and the employer. But if someone has a better answer to that question, let me know. You can either hit me offline or drop a chat down below. Let's see. Just making sure I'm not double answering questions here. If we have an exempt employee that can only work a couple of days due to her husband's schedule due to COVID, is it better to furlough, reduce salary, change to hourly? Husband has to work a different schedule. If you furlough or reduce the schedule, that employee might be able to, will likely be able to apply for unemployment, which is going to cover some of the backfill. For an exempt salaried person, the rule is once they work an hour a week, they have to, or if they work any time at all during a week, they're paid their entire salary. So in a situation like that, where somebody can't work a full week because they got to take leave, for example, you may in that, to care for a family member, you may in that situation want to talk to the employee about, at least on a short-term basis, talk about a renegotiated salary moving forward. So if they're working 3 days a week, you might want to talk about a renegotiated salary at 60% of what their regular salary is, with the understanding that when all goes back to normal, which it will eventually, the salary is going to go back to their regular full-time salary. You would then furlough them for the additional hours. That would enable them to potentially apply for unemployment, make up some of the shortfall. Lots of ways here to help make employees whole as best as possible in what is otherwise a lousy situation. Someone just said they believe the new DOL notice was published today. And I'm going to click on the link, and there it is. So if you, and I'll make sure this gets, I'll see if I can push this out to everybody, but thank you to Corey. Hi, Corey, who says the notice was published today. If you go to the DOL's website, there is an actual notice for non-federal government employees. The FFCRA poster of employee rights. It's short, sweet, one page, spells it all out. This is a mandatory posting, must go up in your workplace by April 1, and you can go right to dol.gov where you can pull up a copy of that posting. I did a webinar 2 weeks ago. I was live on a webinar when the WHO announced that coronavirus was a pandemic, or 3 weeks ago? I don't know. All the days are blending at this point. I don't even know what day it is at this point. Yeah, so I love being able to break news live to everybody. This is awesome. Is it okay to put the poster up in our home? Here, I'm sorry. Let me rephrase that. Is it okay to put the poster up in our workplace if everyone is at home? Do we have to send it via email so people can see it? Yeah, interesting question, because everybody's teleworking now, or a lot of people are teleworking. You have to make it where it's available to people to see in the place where they're going to see it. And if people are working remotely, then yeah, you have to, you have to email it to them. If nobody's in the workplace, then there's an open issue, I guess, as to whether you have to hang it there along with all your other postings. It certainly can't hurt. But certainly you have to make sure that people get it and can see it. Can you change a salaried staff to hourly if they work from home? You can change them to hourly. Keep in mind that once you change a salaried exempt employee to hourly, they're no longer exempt. And so you are going to be potentially on the hook for overtime in a situation where you're not going to have as much control over how many hours in a day someone's working. So your salaried folks are not, your salaried exempt folks are not overtime eligible. If somebody is, you're now going to switch that salaried individual to hourly. If they're working 60 hours a week, you're going to owe them 20 hours of overtime, where before, if they were working 60 hours a week, you just paid them their salary. Preschool teacher is not working because the preschool is closed for COVID-19 precautions. Can they use emergency FMLA leave while preschool is closed if they are home caring for their children whose schools are also closed due to COVID-19 precautions? The answer is yes, provided that this preschool teacher who's home caring for his or her children uh, cannot telework. We know a lot of schools have gone to remote learning. A lot of teachers are going to be working full days managing remote learning for their students as the schools remain open as best as possible from a remote standpoint. My kids are on spring break the last 2 weeks. They're going to start their remote schooling on Tuesday. So assuming that a preschool is not going to a remote learning model, then if this teacher needs to be home to care for his or her children whose school is closed, preschool is closed, then yes, they'd be able to tap into the EFMLA and the paid sick leave as well. Are veterinary clinics considered healthcare workers? I don't believe so, no. I believe healthcare workers is taking care of people. Wonderful, those that take care of animals. I have 2 here. I'm glad that veterinary clinics are considered essential, so they're open if my dogs need something for the foreseeable future, but I don't believe they qualify as FMLA. They don't qualify as healthcare workers under this. Someone says fake ID update. That's hilarious. My daughter, my daughter's outside playing guitar right now with one of the dogs. The band's on hiatus. They've been working to get material together as best they can remotely. They've been having video chats with each other. It's hard with the lag to rehearse via Zoom or other things. So they've been doing the best they can to kind of talk and write and figure things out. I think their gigs for now are probably on hiatus. So at least in the short term, I wonder if she would actually come in and play a song. She'll be so pissed if I ask her. Holy cow, would she be pissed if I put her on the spot to come in? Maybe I'll line that up for next time. I plan on doing these again, so maybe next time I'll line her up and see if she'll come in and play a song for everybody. Can I point you in the direction of the posting? I can. The link was actually up further in the chat, but I will repost it so everyone has it. There it is for everybody. There's the posting. Other questions as we, let's see. I think, and if I've missed other questions, I apologize. I plan on doing this again. I know a lot of people have commented how helpful this was. It's helpful for me too, just to have some interaction with folks, and then to talk through some of these issues too in real time. So I plan on doing this again, at least once or twice a week as we move forward. I want to thank everybody for participating today. Thank you all for your questions. To those of you, I know clients I have on here, we're doing what we can to get you guys through this as best as we can. For those of you who are, people I know on LinkedIn or Twitter that I've been talking to for years, it's really good to see you here. Thank you so much. Everybody, be well, stay safe, stay nice, stay compassionate. We're going to need that as we get through this over the course of the next weeks or months, above everything else. So please, let's do our best to be kind to each other. And then I'll see what I can do to get Nora on here next time to play a song for y'all. So peace out, everybody. Have a great day, and be well. Thank you.